My name is Matt. I'm a 12-year papillary thyroid cancer survivor out of Seattle, Washington. And this morning's session is titled Living with Thyroid Cancer. And we're joined today with Elaine Thrift, is a nurse practitioner at Baptist Health Adult Medicine Specialist in Fort Smith, Arkansas. Ms. Thrift specializes in endocrinology and internal medicine. In addition to being a healthcare professional, she is a thyroid cancer survivor. Diagnosed in 2012 with papillary thyroid cancer, she has experienced the vast emotions and difficulties that accompany a cancer journey. She has used her personal cancer experience to impact the life of many patients.
Hey, thank you. Um, I am Elaine Thrift. You may see me listed as Karen, but that's only for legalities and when my mom is upset with me. Uh, so I was diagnosed 12 years ago.
Okay.
So first of all, let me say good morning, and I'll back up to that. And this is my first year at this conference, and it's been amazing. Any other first year? Oh gosh, several of us. Okay. Lots and lots of knowledge out there, lots of great speakers. So I do thank Gary Bloom and his volunteers for this conference. So when they asked me to speak, I thought, what do I have to add? Where do I start? What can I tell you that you haven't experienced or you don't already know about thyroid cancer? How many of you in this room are greater than 5 years? Okay. Anybody less than 5 years? Okay. So we're divided there. So lots of fears, lots of questions, lots of not getting answers, correct? So this is what I decided to talk about. I didn't want somebody to tell me, well, this is what you should do. This is what you should do standing up here. So I decided to share my story. It's been very interesting. It's been very convoluted. I still don't have a lot of answers 12 years later. I think back to the guy that spoke yesterday with the Chester House and the fear of recurrence. That is probably the best take home from this for me today. So if I ask each of you what your journey with thyroid cancer has been like, I would get different answers. Mine is no different. And I look at us as warriors on this journey. And I have decided through this cancer journey to call it a journey because it has been a physical and emotional ride. And it's just like a journey, lots of ebbs and flows, lots of twisted curves going through each appointment. So a little bit about myself. I am a nurse practitioner, but first I'm a mom, I'm a sister, I'm a daughter, I'm an aunt, and I'm a Nina to my 4 favorite little people in the world that range from 7 months old to 17 years old. I'm also a nurse practitioner, a registered nurse, and I am a papillary thyroid cancer survivor. Those are what I am in different parts of my life. I don't let, or try not anyway, let the thyroid cancer define me. It is part of who I am, and it's made me who I am today. My experience as a nurse practitioner has been primarily internal medicine and endocrinology. And one thing I have learned as a healthcare provider and as a patient, that healthcare providers find it very difficult to be in the role reversal from the provider to the patient. Sometimes I felt like I knew too much and asked too many questions. And on the flip side, in the hospital, they assumed that I knew what I needed. So the nursing staff let me take care of myself. Like I said, I was no different as far as making that role change. Very, very difficult. So let me tell you a little bit about my story. And mine started in 2012, and it still continues today. As I mentioned, this has been an emotional and physical progression through the unknown. I have journaled through this, and I'm going to touch on that briefly, but it's really interesting to go back and see where I was at when I started this and how I've changed at different periods through this walk. So I was at Disney World when I first got the call that my biopsy was positive for papillary thyroid cancer. Um, I can remember I was at a medical conference and I was standing outside taking the phone call by this big dolphin statue. And I was leaning, kind of had my hand on its snout. And the physician that I worked with at the time told me, I'm sorry, but your biopsy was positive for papillary. So, and all I could think of was I have cancer. Um, I was devastated and I was surrounded by all this happiness and all these kids and all the family at the most magical place in the world. And I had no magic. I had cancer. All of a sudden, I was completely devastated. I delivered this same diagnosis several times to patients over the few months and weeks prior to my diagnosis. And at the time I was told I had papillary thyroid cancer. I knew exactly how my patients felt. Um, I also know the feeling of being told that it's the best cancer to have if you're going to have cancer. I see a few smiles and snickers in the room. How many of you guys have heard that same story? I think that is the absolute worst information you can be told. In fact, to this day, those words make me cringe. And since my diagnosis, I have also been told that thyroid cancer was not even a real cancer like breast cancer or colon cancer. I beg to differ. I've gone through a lot of health issues, health scares, surgeries were different. The three cancers or any cancer is completely different, but thyroid cancer is still a cancer. I don't care how you dress it up. I don't care the words you use. It is still cancer. And I pray that I never, ever say those words to a patient, ever. And I reassure them also when they come to see me that, yes, it is a cancer. Yes, it is something to be concerned about. And I try to undo the damage that those not a real cancer words have done. So a little bit about my onset. It started very insidiously, starting with hoarseness, as you can still tell I have, that persisted for months until my voice was a whisper. My sister and I had gone to the beach with our kids, so I just blamed it on the climate change. Then I come back home. Well, I thought it was because I was just talking too much, and which I do anyway. Uh, but I went to Honduras in June of 2012 on a mission trip. It got worse and worse. And I thought, okay, I just talked too much on this trip. It was the warmer climate, very humid. I was just taking guesses. The doctor I worked with referred me to our ENT colleague, and I was diagnosed with papillary thyroid cancer. So in August of 2012, I had the total thyroidectomy, followed by the usual 150 millicuries of radioactive iodine a month later. So I rocked along for 7 years, had my scans, did my labs. Tumor marker, thyroglobulin was always good, less than the 0.01, but I never had a positive scan. Everything was always negative. Just keep that in mind. So due to the initial location of the tumor, I experienced right vocal cord paralysis. Fortunately for me, my sister is a speech language pathologist and has been my advisor on talking too much, how to swallow, not to choke. Um, and she has saved my life many, many times. And as you notice, my voice quality will change as we continue through this presentation. I may cough a lot. I have like the chronic hoarseness, dry mouth, the chronic cough. And I apologize if I do this and it drives you crazy because it drives me insane as well. In March of this year, I had a laryngoplasty at MD Anderson that did help some. For a few months, my voice was crystal clear. I wasn't choking. But as time has progressed, the symptoms have returned. And keep in mind, I talk all day at work. So by the time I get home at night, it's just kind of a croak. I sound like someone that has smoked for 50, 60 years. So back to my ride here. The disease has shaped me and shaped my life, as I know it has for all of you. I have learned a few things that I'd like to share. First of all, I'm stronger in the face of adversity than I ever imagined possible. Being a thyroid cancer survivor and a nurse practitioner has given me a phenomenal platform to educate patients and healthcare professionals and healthcare providers, nurses, other staff members, that this is a very, very real cancer. And I try to educate them for exactly what it is, a cancer. I don't want someone to come in my clinic and feel less because they only have thyroid cancer. I tell them that it is cancer. I talk to their caregivers. I talk to their friends. I just share with them the same thing that I didn't get when I was first diagnosed. In addition to sharing about my story with my patients and their families, I have become an advocate for these people, for these, let me rephrase that, for these individuals. We have one endocrinologist in our area. Population in my city is about 70,000, one endocrinologist. The closest endos around are either in Northwest Arkansas, which is an hour drive, or in Little Rock, which is about a 2.5 hour drive. So I've had the opportunity to collaborate with some endocrinologists, and I see thyroid cancer patients in my office. So you can imagine the conversations we have. We share stories, we share our battle wounds, we share our scars, we have shared tears. And I share what thyroid cancer has taught me, many valuable lessons through this experience. And if I can share my story with them and with you and make differences in one patient's life and one area, no matter how tiny, I feel like my journey has been worthwhile. A couple of lessons that I have learned, and we will have a chance to talk at the end of this. There'll be time to share some of your stories and maybe answer some questions. But the first thing I have learned is thyroid cancer is a thief. I got to thinking about this, and I started looking at what it's taken from me. First and foremost, well, besides my voice, first and foremost, my energy. I can be well rested. I see a lot of heads nodding. I can be very well rested and get up feeling like I hadn't slept all night. Fatigue is just part of the day. And I know my coworkers get tired of saying, well, how are you today? I'm tired. But it also stole my peace about my health. I thought I was fairly healthy until this started. The emotional burden has been probably the biggest part of this. It has been very overwhelming. It has caused my anxiety to escalate. It causes me to experience fear with each challenge that I have faced. I have described it as a mental, physical, and financial burden. And I will get to those as we've talked about the mental part, the anxiety, the physical part, the financial burden. Cancer is not cheap. Copays, out-of-pocket expenses, travel, lack of insurance coverage, which I experienced because MD Anderson was out of network. I will get to that in just a moment, the other additional battles I've dealt with. But I, like you, live daily with side effects. As I mentioned, the chronic hoarseness, the dry mouth, dry eyes, chronic fatigue, cold intolerance, and weight gain. No matter how little I eat, how much I eat, weight is an issue. I exercise, the thyroid weight hangs around. So some people may not really recognize that as a burden, but as a middle-aged woman, I do. And I recognize that in others, that is something very personal to them. I also experience, as I mentioned, the fear of recurrence that the speakers met, or that we heard yesterday, spoke about. And I still, no matter 12 years later, I still experience this with each visit, with each lab test, with each PET scan, with each thyroid neck ultrasound. There's always that fear of the unknown. I had to learn to become my own advocate. And one thing I did learn is no does not always mean no. I learned persistence through this because I was in the fight for my life. I felt like I was up against a wall. No one was helping me. I just kept getting pushed from place to place. It's just thyroid cancer. The insurance companies were no help at all when they denied the imaging and lab work that was necessary. As I mentioned, I've been responsible for a great deal of out-of-pocket expenses due to insurance difficulties and out-of-network coverage. I was also informed by my insurance company that it was just thyroid cancer. A local oncologist could treat it. I saw a colleague, a local oncologist, who performed a few scans and lab work and told me I needed to see an endocrinologist as he did not treat thyroid cancer. I knew this. I was just playing the insurance game. I knew I needed an endocrinologist, but as I mentioned, we did not have one in my area. So I was fortunate to connect with Dr. Rachel Kilpatrick, an endocrinologist in Fayetteville, Arkansas. And my thyroglobulin was continuing to increase. I had lymph node metastasis. So I had had a neck dissection on 2 separate occasions and a second round of radioactive iodine. So a few months following the radioactive iodine, let me mention again, I had a negative metascan following the last treatment. So follow-up a few months later revealed that I had a large mass on my trachea that had not been present prior to the radioactive iodine. So a biopsy was performed, and guess what? It was papillary thyroid cancer. At this time, she was at a loss as to what to do with me and referred me for advanced care at MD Anderson. I finally felt like I was making progress in this journey with metastatic papillary thyroid cancer. I faced another hurdle as MD Anderson was out of my insurance's network. At this point, I felt very helpless and scared. I was in the fight for my life, and I felt like I was doing this fight alone. The first person at MD Anderson told me that they could not help me because insurance would not allow them since they were in out-of-pocket, out-of-network expense. And I asked about paying for it myself, and she said, no, that was not possible since I had insurance. So I felt like at this point, I was just hanging out there in this world of unknown. No providers in my area. The provider that I saw felt that I needed a higher level of care. I couldn't get anywhere. After many, many tears, meltdowns, and worsening anxiety, and of course, the fear and increasing financial burden of cancer, I was finally assigned a case manager through my insurance. And this woman named Deborah was a godsend for me. She fought for me like I needed, like she gave me the help that I needed. And finally, I was able to get into MD Anderson under insurance coverage. So my first appointment was scheduled with Dr. Cabanillas at MD Anderson, and she spoke yesterday, if y'all had a chance to see her. And keep in mind, I live in the western part of Arkansas, closest to Oklahoma border, which is an 8-hour drive from my home to MD Anderson. Finally, I felt like my persistence in advocating for my health care had paid off, and it was a full-time job. After seeing Dr. Cabanillas, she gave me the answers that I needed. I had molecular testing and was diagnosed with the BRAF and TERT mutated papillary thyroid cancer. So that explained why my 2 radioactive iodines were a failure. That explained why I never had a positive metascan. That's why they were always negative despite the increasing thyroglobulin. So I felt like I had made huge strides just getting those answers. So I underwent in September of 2019 during a tropical storm here in Houston, I underwent a paratracheal resection. I developed a post-operative infection that required another surgery to clean out the infected site. I was then treated with 6 months of targeted treatment with Taflunar and Mekinist, before attempting a third radioactive iodine treatment. We were hoping for redifferentiation. Again, I had to fight with my insurance company because they felt these two medications, one, were too expensive, and two, unnecessary. Why? This is a question I have to this day. Why is it such a battle to get the things that you need when recommended by people that know what they're doing, people that study these medicines? I could go down that rabbit hole on insurance as a provider, and we could be here all day, but I'll spare you that. So during this time, I continued to work in our clinic, seeing patients despite the nausea and vomiting that I experienced. And one thing about me is I always try to find humor in anything, often inappropriate, but I try to find the humor in it. So I ordered emesis bags off of Amazon, and I noticed when I select purchase, the ones I selected had a 5-star review. And my thought was, I could not imagine who would give emesis bags a 5-star review. Well, as I read them, they were quite comical. Lyft and Uber drivers do. And I thought, I guess if anyone knew that which bags were the best, they would. These were lifesavers. I had them strategically placed at the office, in my pocket of my lab jacket, in my pocket of my pants, at my house. Looks like everywhere I went, there was an emesis bag. In my car, my sister and I went to see Hootie and the Blowfish, and I had one in my pocket, just hanging out, singing at the concert, just had my bag there just in case. So I say that to laugh, to find the humor in anything with it. We can't be all serious the whole time. And it took little emesis bags to make me laugh about this journey. But the most embarrassing incident I have, and I'm very thankful for my 5-star bag, was when I threw up in front of a patient in the exam room. I still see this patient today, and she will still laugh and say, "Remember when?" Yes, ma'am. Every time I see you, I think, yes, I threw up in front of her. So she knew my situation at the time, and we have a good laugh over it. Thankfully, I'm well past the side effects of those medications. So following my third radioactive iodine treatment, which I had a lifetime total of 465 millicuries, my thyroglobulin remained elevated. So the redifferentiation therapy did not work. Now I was terrified. This was relentless. This simple cancer that I had been told was becoming more and more difficult. So on November 14th of 2021, this was the same day I closed on my new home, I had a follow-up CT that revealed a mass on both kidneys that was concerning for renal cell carcinoma. The biopsy, however, revealed that I had papillary thyroid cancer on both kidneys. Again, I was terrified. I had worked in dialysis as a new nurse and was terrified at the thought of anything being wrong with my kidneys. In talking about treatment options, there was a difference of opinion with my local urologist, who was also a colleague, and my MD Anderson providers. MD Anderson at that time was unaware of any papillary thyroid cancer metastasis to the kidneys. So I've always dared to be different. This was not the place I wanted to be different. So I chose to proceed with a bilateral partial nephrectomy instead of radiofrequency ablation. I had these two surgeries performed in February and April of 2022. I could not comprehend what was happening. This was, again, no simple cancer, and I decided whoever coined that statement had never had thyroid cancer. Several months later, after recovering from my kidney surgeries and beginning to feel more like myself, I had a benign skin lesion appearing on my neck. My son was getting married, and I just didn't want it in the picture. So I saw a friend of mine and had her take it off for cosmetic appearances. She went ahead and did a biopsy because of my weird presentation with everything. And guess what it was? It was papillary thyroid cancer. Margins were negative. We're continuing to follow it. notified Dr. Cabanillas, there was no awareness of papillary mets to the skin. Really a scary thought. And I have asked, why me? Why not me? Maybe this is why, so I can share my story with you, with my patients, and use this as a platform to bring more awareness to thyroid cancers. This was a fight I could not do alone. I've mentioned my sister, I've mentioned my family. I consider it my tribe. I felt like God was placing people in my life to walk this journey with me. People that I would have never expected to become part of my tribe did. Some were here only for a short period of time, and some remain with me today. And some are listening to me at home this morning. I am grateful for everyone that has been with me. As I said, many have been with me from the beginning, and I'm going to get tearful, but my sister, Stephanie, has been my rock through this. We may have fought as kids, and I promise you I was the meaner of the two. And she has stood by me through the last 12 years of this journey. She has sacrificed her time from her family and her work to travel to MD Anderson with me for appointments and surgeries. And she is my second set of years. She is with me today, and I can't thank her enough for being with me through every step of this journey. Thank you. She has been my voice of reason and my emotional support person. She has listened and heard what the doctor said when the news was so overwhelming that I couldn't even begin to tell you what was said. All I could hear was, "You have cancer, you have cancer." We have laughed, we have cried, we have argued through this journey, but she, like I said, has been my rock. My mom and my daughter also traveled the long distance from Arkansas to MD Anderson for appointments and surgeries. Our mom has leukemia and lymphoma, and it was a taxing effort on her part to come, but she was here. We have made special memories on these trips. Usually we take a quick beach trip to Galveston. When we're here, we always kind of figure out enough time to go see the water, sit on the beach, and then go eat. We took our mom to the beach for her first time ever. And just the joy of her seeing the ocean, having her feet in the water, and her hair blowing in the wind has been worth the drive here. My grandchildren, Macy, Easton, and Cam, have stayed with me during my recovery. They have learned to be a nurse. They have taught me, or that I have taught them compassion and patience, as well as they have taught me what it was like to have teenagers in the home again. My son Garrett and his wife have stayed with me following surgery. And even my son-in-law Cody stayed with me at time and babysat Nina. My dear friends Kim and Jeff have taken care of me and my dogs, two dogs, for throughout this whole time. We have been friends for 7 years, and they have been there every step of the way as well. My extended family, my coworkers and friends have been there bringing me food, bringing me laughter, bringing me a shoulder to cry on. That I can't even tell you what a blessing these people have been to me. The laughter and tears that we have all shared have bonded our friendship for a lifetime. And my brother, who I always thought was my biggest little pest in the world, even attempted to meet us in Houston for my surgery, but was unable to make it due to the tropical storm. So he flew from Northwest Arkansas to Dallas and was told he could not fly on to Houston, so he flew back from Dallas to Northwest Arkansas. He still complains to this day. Although we got divorced during this journey, Stan has been a big part of it. And this is another one of my funny thyroid cancer surgeries. And it is really hard to put into words the humor of this story, but he drove me from home from Houston following my third radioactive iodine treatment. So I was considered hot. We had to keep 6 feet between us in the van. I couldn't fly and I didn't feel like driving. So he had his dad's minivan, had it strategically measured 6 feet from where I would sit in the very back and the way back to where he was sitting in the driver's seat. He had it set up, as I said, like a playpen. I had food, I had a egg crate back there, I had pillows, I had water, and I rode all the way from Houston to Fort Smith, longer than 8 hours, looking out the back window. I am very grateful because I am not sure how I would have gotten home otherwise. And you talk about a long trip. It probably took us 8 to 12 hours, or probably 10 to 12 hours to get home for us having to stop so he wouldn't be exposed too long. My experience with thyroid cancer has made me more aware of others. In yoga, excuse me, in yoga, I was sitting in front of a friend of mine and noticed a mass on her neck, which eventually was diagnosed as follicular thyroid cancer. We were not close friends at the time, and I had just grown to know her, and I looked at her and said, Jan, can I feel of your neck? Talk about getting up close and personal. I did, and she had a mass on her neck. So I encouraged her to get that checked, and she and I have walked my journey of thyroid cancer and her journey of thyroid cancer together. We even made a slumber party of it when she stayed at my house during her quarantine after radioactive iodine treatment. I figured after 465 millicuries, there wasn't much she could do to me. We watched movies, Hocus Pocus. It was around fall season, so we watched movies I hadn't even seen, and her husband delivered pizza and food every night. During this journey, my faith in God increased. My church family provided meals, words of hope, and prayers. One thing I have learned through this journey is said in James 4:7, you're either entering a storm, you're either coming, I'm sorry, let me start over. You're either in a storm, coming out of a storm, or preparing to enter a storm. And I feel like the ebbs and flows of this journey for me has been the same. Um, it's been a storm. And I think if I ask each one of you, you've kind of been in that, either in a storm, coming out of a storm, or getting prepared to go into another storm. I close with this, and I know we're going to finish this early, but I want to give each of you a chance to share some things, some quick things about what you have learned through this journey. Thyroid cancer is not one size fits all. I know they try to stuff us in the little square. It's papillary. This is what it does. This is follicular. This is what it does. This is medullary. It goes in this box, and anaplastic goes in this box. We know better than that. Make your journey about you. Don't let it define who you are, but know that it is a big part of the person that you have become. And big thing I can recommend is be your own advocate and educate those around you to advocate for you. Ask questions. I feel as a provider, the most educated patient that understands what's going on is the one that asks questions. And I do. As a patient, I ask questions. As a healthcare provider, I encourage my patients to ask questions. But just know even though it's a big part of your life, as I said, it does not define who you are. Be your own advocate. I did say that. Take advantage of support groups. Become involved with ThyCa. I think each of us in this room have something to offer. Be courageous. Live life and do the things that you want to do. Don't save anything for later. We never know when later may be. Cancer or no cancer, enjoy life. Travel. My sister is my travel buddy, and we have had some very fun trips. If I had my emesis bags, had to take those. We had them. We have traveled coast to coast. We have been to California. We have been to the East Coast. We've been to New York. We have been to Canada, and we love to hang out on the Gulf Coast as well. So travel, spend time with family and friends, and make those memories. So I encourage each of you to find your own tribe. You need the laughter and the support that they will provide for you. Each person that has walked with me through this journey has contributed something so valuable. And I am forever grateful for that. And as I mentioned earlier, I recommend journaling. I find it interesting to go back and read old journal entries from when I was first diagnosed to even a month ago, how things have changed, how it's just taken me on this winding road that I never imagined I would be on. As I read these journal entries, it reveals just how far I've come in this journey. And one thing about it, I have learned I have survived 100% of the challenges that thyroid cancer has thrown at me. It may not have been a pretty journey, and it was a painful journey many times. And now, as I mentioned, I live daily with the side effects, but I am a survivor, and so are you. Our scars are the roadmaps of each individual journey. And I am grateful that I have been able to use my experience with thyroid cancer to glorify God and minister to others. I challenge you to write your own story and make it great. It's about you. Thank you. So as I said, I was going to finish early and I wanted to leave time for questions, comments, but I would also like for anyone that wants to say something, to share with us something you have learned through your own journey. I know as I look around the room, I can point to each of you and you've each had a different journey, whether you're the person living with thyroid cancer or you're the caregiver living with the person with thyroid cancer.
Thank you so much for sharing your story, what I learned through it, and coming to ThyCa. It's 10 years from my diagnosis of papillary thyroid cancer, and is validation to hear. Sorry. Just to hear, like, gosh, I'm not crazy, you know? She has all those same symptoms that 10 years later, you know, that I'm still going through. And, you know, to be validated other than, oh, well, you shouldn't be feeling that way. We have you on the right dose, or, you know, you're not going through active treatment right now, but there are still side effects, you know, even years later. And but I like what you said and the encouragement, because that's what I have found is my purpose. So I didn't go through the pain or that journey, even though at the beginning, right, when you're first going, as some of those are in here, when you're first going through something, you really don't know what to do, or because you're just still trying to take it in and you don't even know what questions to ask. So I commend those that are here beginning their journey, to hear from those of us and someone like you in the medical profession as well as beneficial. And so, but I guess one question I do have is, you know, most of the treatment, of course, is with radiation. And so sometimes with follow-ups, we have to go get CTs that expose us, you know, to more radiation, or when we get mammograms as females, you know, there's radiation. And I didn't even know there was such a thing as a thyroid collar until after my cancer diagnosis. But then when you ask for it, they are hesitant, or I go to give it to you because they say, oh, you're exposed to that amount or less, you know, more radiation when you fly in an airplane. And so, but again, they don't know our journey. They don't know our fears of recurrence. So what do you recommend in regards to, you know, routine exams? Is there something to protect ourselves? Should we be protecting, you know? So that's my question.
Okay, great question. And thank you for sharing some of your journey as well. When I was a kid, and I don't know how much this plays into it, I had a lot of dental issues and they never offered to cover the thyroid. They threw the lead up to about right here, but never actually covered my thyroid. since I've had all of my thyroid issues, they have it up to my neck, like way up here to protect me. I thought, well, the damage is done, but I just remind them that like my providers, especially if it's something unnecessary, is this really the best route to go? I've had all this radioactive iodine. I don't know what the long-term side effects of that is gonna be. I try not to imagine that, but I just remind your healthcare provider that you are concerned and to recommend using the lowest absolute dose of iodine possible or of radiation possible. But do continue to get your mammograms. Yes. Would anyone else like to share anything from their journey that they've learned, something, a pearl that we could take from you? Yes, ma'am.
Hello, everyone. I'm 5 year survivor of papillary thyroid cancer, and I'm a physician. So I understand where you're coming from, being a healthcare provider and a patient. And what it has taught me is a lot more compassion and understanding the other side. Sometimes when you're a healthcare provider, you're all involved in just, the science and what you're doing, but seeing it from the other side just makes you more compassionate and understanding
Yes.
the fear, understanding the unknown. Even though you think you know, then there's a lot of things that we still don't know.
Yes.
And also, I feel that the stress that you get in this, hamster wheel of working, you don't take care of yourself. So for me, I learned to take care of myself more and others more in a different way. So if I can share that with the rest is, I thought that the keynote speaker about mindfulness and PTSD and that, I think that touches us in different ways, but try to live in the moment. And you don't know when you get that call and your life changes immediately in 1 second. So try to enjoy what you have and be with the people that you love and do what you love.
That is so true. Thank you. And I liked what he reminded us to do, the keynote speaker, was to live in the moment. You can go down the rabbit hole of cancer and treatment and your numbers and kind of forget that we have the here and the right now and enjoy it and live it. And as she mentioned, take care of yourself. Not just for thyroid cancer, just for your mental health and your physical well-being as well. I will plug walking, great exercise, swimming. Have I been doing it lately? No. So you guys are going to motivate me to get out and be more conscious of what I need to do to take care of myself as well.
I just wondering if you will do the surgery. So if you get timing back, do you do the surgery? Because I won't. I've been very blessed. I don't have any issues almost for 9 years, but just going to the doctor, just going to the blood, taking the pill at certain times, when people are sleeping, I'm getting up and all these ramifications, blood tests. I personally, so everybody's different, but I don't think I would like to do it because I only eat before, not even vitamins. I didn't take anything very healthy until this happens. And if somebody asks me, I give them my personal opinion, which is only personally. So I just wondering, what's your opinion?
Would I do it again?
I mean, yeah, if you get timing back and that's your
Right.
first time you're gonna do the operation, that you will do it?
My tumor was probably about 2.5 to 3 centimeters on the right side, so it was affecting my swallowing. I would probably say yes. If it was smaller, it may have been something to consider, but I was already having symptoms related to the size of the tumor. I have had, I think I have had 8 or 9 neck surgeries since all of this started. So I commend you for not having the surgery, continuing the surveillance and following up with your healthcare provider. And that's what's unique about this. This is an individual journey and you're in charge. They can tell you what to do, they can tell you what you have to do, but you need to be in charge of your health care and you need to do your research and make the decision of what works best for you. Thank you. Yes,
I'll
ma'am.
just add on to that a little bit. For me personally, I thought I never had, Graves or Hashimoto's. There's absolutely no history of thyroid anything in my family. But I found this lymph node that just kept growing and growing on the side of my neck, and it was growing pretty quickly and getting really big and kind of like goose egg size by the time I had surgery. And then I just had a recurrence discovered a couple months ago, and I had a mass that was up against my trachea and my carotid. So obviously, if that's going to grow, then I mean, everybody's different, but sometimes just kind of where things are positioned, it could be like life threatening or decrease your quality of life if it's going to grow in that spot. But onto sort of, I don't know if I have really anything to share because I don't feel like I've, I went through it 3 years ago and I was in vet school and then I was a new veterinarian. So the whole, maybe medical providers can sort of feel kinship with this. So they take care of themselves the worst.
Yes.
And so I was having a really hard time, like, oh, I have to put like either my education first or my patients first. And I remember in my first job, I was hoping that like, oh, I'll have money, I'll have insurance, I'll finally be able to take care of myself, I'll finally have that work-life
Right.
balance. And then it was the complete opposite. I was working 12-hour days, even though we're only open, 8 to 5. I'm staying till like 7:30 doing my notes and doing research to help my patients as best as I can. And even though I just felt like I was a zombie in my body, like I can't not be there for my patients. They depend on me. And so it's just been really difficult to find that balance for me, the follow-up care and just, I guess what my question is just like any tips anyone has about things that they do to maintain their wellness, whether it's small or big or habits that they found that help them just to kind of incorporate into a daily lifestyle to really find that balance because I'm not very good at it.
I'm not either. So I'm open to any suggestions. I have tried for years to find the work-life balance since was diagnosed and through this journey with thyroid cancer. I can sleep for 12 hours and still wake up fatigued. I'm best in the morning. So I try to do all the heavy thinking that I have to do first thing in the morning. My schedule, as yours probably does, always doesn't allow that. So you get the worst patients maybe in the afternoon, and it requires you to really dig deep. I promote exercise. I would talk to your provider about which vitamins are recommended and a balanced diet. I've recently just started just a more healthy diet. I could eat junk food with the best of you, but I also feel worse. So, try to get in some sunshine, some mindful meditation, the deep breathing, nap when you can. I have a couch in my office, and if I had time, I would lay down and shut my eyes for 20 or 30 minutes. And sometimes I think that would rejuvenate me during the day. But anyone have any suggestions?
Oh, and another thing, if
Yeah.
anyone has anything helpful about the heat intolerance, because that's been really difficult for the physical activity, especially here in the South.
Okay. I have the opposite. I have cold intolerance, and right now I am freezing standing up here.
I was going to answer your question. I'd say partially my own, like what I was going to say after yours, is that my cancer diagnosis has sort of forced me, like I lost my sense of taste and smell. And I was a pretty picky eater. So I had to sort of force myself to be adventurous, which was really hard to think outside the box because I was just not eating anything. And they said, start eating things you've never tried before. So I sort of adopted this, like, we do lots of things we don't want to do. And I have the t-shirt that says it, like, you can do hard things. So start doing the things that you didn't think you could do. And instead of like, they told me, yeah, you get exercise will help your mindset and your physical health and, move things through your system and all those kinds of things. And I thought, I don't want to walk and I don't want to run. And I cannot do yoga. I'm going to box. Like, I am just so angry at everything that this has taken from me, everything that it touches, the relationships, like everything. I mean, it has taken everything from things out of my bank account to the time I spend with my kids, my parents, like everything, that I've taken up boxing and just started throwing punches to sort of just get rid of all of the stress. And I can tell you, it is hugely helpful. I'm now an orange belt in both kickbox and karate and jujitsu. So you know what?
Yay.
You can take it and like, I'm sort of just changing the trajectory of where I thought I was going to go, and like grieving the loss of where I thought my life would go, and sort of accepting where I get to change it and take it now. If that makes sense. So whatever it is that like sparks that joy in you, go do it.
Thank you. It is difficult when you realize, as you said, grieving what you thought life would be and where you're going, and you can change the trajectory. Yes, ma'am.
For my experience, I didn't have, I'm just 1 year out. I didn't have any thyroid symptoms. It was an incidental finding when I went to the emergency room for like abdominal pain. I thought I had endometriosis. So just to give that context, for me, what's helped in the last year, I have a super demanding job. So one of my friends who does have endometriosis reminded me, don't forget there's such a thing as intermittent FMLA, not just continuous. So that has really saved me to have that. At least I can have a blanket statement for a duration of time. And I spoke with my doctor to say, okay, this is the parameters. If it's like X number of instances within, like 1 to 3 days, you can only have up to 3 times a month or whatever it is. So that was something that's helped me. I haven't asked for workplace accommodations, but someone here at the conference mentioned that could be helpful as well. And then I've just been learning to listen to my body. Like yesterday evening, I skipped the dinner because I just was maxed out. I paid for the tickets, so I was upset. I wanted to socialize, but it's just been really taxing. So I just messaged the people at my table and said, I can't make it. Like, I had my partner get food for me instead. And I watched Hallmark Channel. Like, I listened to my body and I'm proud of myself that I did that. But identifying things that make me happy. And so for me, that's Hallmark Channel. And I had it on. That's it. And then just changing my environment. I'm really lucky that I work remote. So once a year, on my anniversary date, we go to Europe and watch a Formula One race. So I'm lucky that I get to do that. But if I don't feel good, I live in an outdoor state, so I make sure that before I start work, I walk across the street to go to the lake. And I have this pair of boyfriend-girlfriend ducks that I follow, and I just look at them and they make me happy. So look at them interacting with each other, and he gets jealous when the girl gets another boy duck trying to quack at her. So those small little things, trying to find everyday things, noticing the small stuff, has helped me.
Thank you. Live in the moment.
Oh,
Yes.
and then also, I don't know if anyone cares, but there's a women-based brand for the medicine pills that I use that I really like. Instead of using those free plastic ones from the pharmacy, it just has helped me in my daily basis because I don't feel like, as much as I am in my golden girl era, I don't want to be using the plastic ones from the pharmacy. It just makes me feel sad. So changing the parcel that I have to take my medicine in doesn't make me excited to take medicine, but it helps make it easier.
Thank you. So I think we're almost out of time. Were there any online questions? No. Okay. I just encourage you guys to live big, live in the moment. Know that your thyroid cancer does not define you. It may change the trajectory of where you thought life was going, but just roll with it and make your own way through this and be an advocate for others. Thank you.